Have you ever felt your heart racing before an exam? For real, have you? Or maybe you notice that your mouth go dry when you are nervous. Maybe you must have wondered, why can't I tell my heart to calm down? Calm down. Just the way you can tell your hand right now to calm down if your hand is shaking. That's because there's an entire nervous system running in the background of your body right now, controlling your heart rate, your digestion, even making you sweat. And funny enough, you have zero control, conscious control over this thing. This is what we call the autonomic nervous system, all right? And honestly speaking, it's one of the most important systems you will ever learn in anatomy and physiology. Anatomy is what? Location, location, location. Or what? Structure, structure, structure. And physiology is what? Function, function, function. The normal things, all right? Because when you do the normal, you'll be able to know what? The abnormal. The abnormal is what? Pathology. Then you know how to take care of that abnormal. That is what? Pharmacology, surgery, medicine. All right? This doesn't substitute for your lectures, but instead, this is a recap for your exams, all right? Because we are discussing a whole lot of questions for you to be able to understand the autonomic nervous system. Now, I know what you're thinking. Great. Another complex system with millions of parts to memorize. But here's the thing. The autonomic nervous system, rather, that's the ANS, is actually beautifully simple once you understand the logic behind it. And the logic is just two divisions, playing opposite roles, right? One says, run for your life. And the other one says, relax, relax. Let's just digest some food. So today I'm going to break down everything you need to know. Everything you need to know about the autonomic nervous system, from the sympathetic and parasympathetic division to the neurotransmitters, to exactly how your body maintains balance without even you thinking about it. And I promise you, by the end of this video, you will never look back at your body the same way you did before. All right? So let's go in. In response to the high blood pressure, stretch receptors called DASH in the walls of arteries carry blood to the head will trigger a reflex that causes the heart to dash its beats per minute. Does it make sense? Baroreceptor proprioceptors decreases, baroreceptors decreases or increases, proprioceptors increases, chemoreceptors increases. The motor pathway of the autonomic nervous system usually involves dash neuron. How many neuron? No neuron. 1, 2, 3, 4, 5, 6, 7. The preganglionic axons run from the dash to the dash. The preganglionic axons of the autonomic efferent pathway dash, and they secrete what? Dash. Is it myelinated and norepinephrine? Is it myelinated and acetylcholine? Is it myelinated and acetylcholine and norepinephrine? Is it myelinated and acetylcholine? Is it unmyelinated and norepinephrine? Which of the following is not a reason that somatic reflexes act faster than the visceral reflex? We are going to discuss a lot of questions. Trust me. That's why our learning objective is to explain how the autonomic and the somatic nervous system differ in form and function, to identify the anatomical components and pathways of sympathetic and parasympathetic divisions, to name the neurotransmitters and the receptors used in ANS and also explain their effects, to explain the autonomic nervous system, rather, controls organs through dual innervation and autonomic tone, and also to describe the enteric nervous system and central control mechanism. All your questions usually rotates around these concepts. We are going to discuss the concepts, then we also attack the questions in between as we go from beginning to the ending. So I expect you to take pen and paper, listen, write down. By the time you watch this video 1, 2, 3 times, you must be very competent in autonomic nervous system for your college exams and also for your board exams, all right? Simply put, autonomic nervous system is self-governed, right? That's why it's autonomic, like automatic. It's independent of what you think or your will. It doesn't care about you. Don't mind me, all right? But what it usually does is it regulates fundamental states and life processes such as what? Heart rate, blood pressure, body temperature. That's why Walter Cannon coined that word, homeostasis, and flight or fight, right? And he dedicated everything about himself to anterior nervous system. If you want to understand the difference between autonomic and somatic nervous system, I'd explain them in my video in Neuro 1, Neuro 2, Neuro 3. So I will encourage you to go back to those videos and look at it properly. But if you look at this slide here, you see a clear difference between autonomic nervous system and, mind you, we have something we call the sensory. That's the one that goes to the CNS, and also the motor, the one that comes from the CNS. You need to differentiate these two. Now, the sensory, the one that goes to the CNS, can be going to the CNS from the body or the skeletal system, all right? Can be the muscles, can be the joint. That one we call what? Somatic. Somatic sensory. It goes from the skeletal tissues, all right? Now, there is the one that goes from the viscerals or from the organs to the CNS. That one we call it what? sensory viscera. It's sensory because it goes to the CNS. It's visceral because it goes from the organs. But the one that goes from the skeletal muscles, we call it what? Somatic, somatosensory. I don't know if you get the clear explanation. I'm trying to break it down to the smallest limit so that you'll be able to understand it. Now, let's talk about coming back. Coming back is motor, right? Yes. That's from the CNS to its target. So if it's coming back from the CNS to the skeletal system, all right, that is called what? Motosomatic. If it's coming back from the CNS to the viscerals, that is the cardiac and the smooth muscles, all right, that is what we call the motovisceral. So we have motosomatic or somatic motor and motovisceral or visceral motor. Does it make sense? So motor is that it's coming back, visceral is that it's going to the organ, smooth and cardiac. Does it make sense? Now, that one that is coming back from the organ can be divided into sympathetic and parasympathetic. And that is the one we call what? Autonomic nervous system. So autonomic nervous system is divided into sympathetic and parasympathetic. But if you're focusing on this slide, you will see I broke it down, the autonomic nervous system and the somatic nervous system. The effectors, the control, the pathway, the function. You must know these things because that's what they will ask you in your exam. I'm only explaining for you to be able to get the clear picture. All right? So the effectors is the cardiac and the smooth muscle and the gland. That's why I told you. The effectors is cardiac, the smooth muscle, and the gland. But for somatic, the effectors is skeletal muscle only. So anything that's going to the skeletal is somatic. If it is going to the skeletal from the CNS, it is a somatic motor. If it is going from the skeletal to the CNS, sensory somatic. You need to know this. Now, the control for autonomic nervous system is involuntary. You can't control it. For somatic, it's voluntary. And the pathway for autonomic is 2 neuron chain. 2. So the answer to that question I mentioned initially is what? 2. It has preganglionic and postganglionic. Check it out. But the somatic is single myelinated motor neuron. The function for the ANS, that's autonomic nervous system, is to maintain homeostasis, adjust body organ activity. Which is why, if you look at this slide, I mentioned that its key function is heart rate regulation, blood pressure control, body temperature, digestion, and glandular secretion. That is what they will test you on. But for the somatic one, it's usually body movements adjust and postural adjustment. I don't know if this is clear. Please, if it's not clear, I need you to go back and watch it again. All right? Link it up with all the neuro videos I've already posted. Now, because we are dealing with the viscerals, that's the smooth, all right, and also the cardiac and the glands, there's something we call reflexes. What are visceral reflexes? They are unconscious, automatic, stereotyped responses to stimulation, involve visceral receptors and effectors. You need to know this. Involve visceral receptors and effectors, which is exactly what I'm showing you there, the baroreceptor reflex. All right. Now, that thing you are looking there on the diagram is what we call a visceral reflex arc. What does it involve? Involve the receptors that are nerve endings that detect stretch, tissue damage, blood chemicals, body temperature, and other stimuli. So immediately these things are detected, what happens? The efferent goes to the CNS. Immediately it goes to the integrating center in the medulla oblongata. All right? Now, it goes to the integrating center, which is the interneurons on the CNS. Then from there, it's interpreted, and it comes back, all right, to the east target center by the efferent neurons. So the efferent neurons carry motor signals away from the CNS, right, to the effectors. Then effectors carry out the response. The autonomic nervous system is considered an efferent pathway. I'm stressing on it. It's considered an efferent pathway, the one that is coming down. You see that arrow, the green arrow coming down? That is what we consider as the autonomic nervous system. So to recap, this is a reflex arc, all right, a reflex arc showing the receptors that detect the chemical change. Then the afferent neuron that takes the information to the CNS. Then the CNS integrates it, right? That's in the integrating center using the interneurons. Then after that, it gives the information back using the efferent neurons that carries the motor signals away from the CNS, then to the effectors. And ANS, autonomic nervous system, is considered an efferent pathway. It is a question that they will ask. So they will ask you a question like, the effect of the autonomic fibers on the target cell is dash. So that effect can be excitatory or inhibitory, though we still discuss that. And for the somatic fibers, the effect is always excitatory, all right? Now, they will ask you a question to describe the visceral reflex. You should be able to describe the visceral reflex, all right? Which is sensory receptor to the efferent nerve fiber, then to the interneuron, which I just described now, then to the efferent nerve fiber, then to the gland. Does it make sense? I hope you understand this. Then they may ask you, mention the things that the autonomic nervous system fibers are involved in, all right? Or which one is not involved in autonomic. All right. So you need to know what they do. I've already listed it out for you, like regulating gastrointestinal motility. That's digestive pathway. Also altering the salivary mucus secretion, adjusting the heart rate and force, changing the diameter of the pupil. All these things that the autonomic nervous system does. Maintaining the tonicity of the muscles of the neck. Is it the autonomic nervous system? No, that is not the autonomic nervous system. All right, that's the somatic because it was skeletal. That's what I need you to understand. So these are the two divisions of the autonomic nervous system that I mentioned initially, and they cooperate a lot, and sometimes they contrast, all right, to have effects. All right, we have the sympathetic and the parasympathetic, and those are the things that they do. Very important that is the sympathetic and the parasympathetic. The sympathetic prepares the body for physical activity, all right, physical activity, exercise, trauma, arousal, competition, anger, or fear. All right, that's why we call it flight or flight. All right, it increases the heart rate, blood pressure, airflow, blood glucose level, and all those things. All right, the parasympathetic is calm, rest, and digest. All right, calmer. It calms many body functions, reducing energy expenditure and assists in body maintenance. Digestion, waste elimination is increased at that level. So in summary, sympathetic, fight or flight, increase heart rate, blood pressure, dilate airways, increase blood glucose, reduce digestion, dilate pupil. Parasympathetic does opposites. All right? But parasympathetic promotes digestion. That's why when your heart is calm, when you are resting, you understand, you feel like pooing, you feel like weeing. All right? But when you see somebody running, have you ever been running before? You are running for your life and you want to shit. You have to wait for you to finish that thing. You are running for your life first. You see? So sympathetic inhibits digestion. It reduces it. And also inhibits urinary system. So you need to understand these two contrasting things because that's where you'll be tested on. For example, they ask this question: which of the following statements are true regarding parasympathetic tone? First of all, when you're talking about tone is just the normal background rate of activity that represents the balance of the two systems, all right, according to the body's need. That's what tone is. Like when you start a vehicle, but you've not entered it, you've not moved, you want to warm it up. That's what tone is. We have the parasympathetic tone and we have sympathetic tone. But all of them still plays with the parasympathetic activity that we discussed and the sympathetic activity that we've discussed. Very, very important that you know this. All right. Now they ask you that question. How will you respond? Now look at the option. The question again. Which of the following statements is true regarding parasympathetic tone? It holds the resting heart rate below its intrinsic rate. It accelerates the resting heart rate above its intrinsic rate. No, that is wrong. It doesn't accelerate it. It might increase or decrease heart rate depending on the situation. No, parasympathetic does not increase heart rate. It affects heart rate only after myocardial infarction. It does not affect heart rate. It drops heart rate. So look at that first option. It holds the resting heart rate below its intrinsic rate. Yes, that's just a lot of ways to tell you that it reduces the heart rate. Parasympathetic. That's how they will ask you this question. Or they may tell you sympathetic axons are not associated with dash. Are not. Sympathetic are not. What are they associated with? Anger. Yes. Exercise. Yes. Stress. Yes. Arousal, like when you are aroused to do something, maybe to have sex or something. That's sympathetic. Yes. Stimulation of digestion. No. That's parasympathetic. You see how you catch these people? That is how you catch them. Or they may ask you, the background rate of sympathetic and parasympathetic activity is called, just told you some minutes ago. I told you that's what we call autonomic tone. You remember when I was mentioning that, okay, you start a car, you just leave it to warm in this cold temperature. That's tone. So autonomic tone is that background rate of sympathetic and parasympathetic activity. Even when you are sleeping, there's something happening. There is a balance. There's something happening because you are alive. That's what we call. Finally, for this, another thing you need to know is about denervation of autonomic nervous system. When autonomic nervous system is innervated, that's denervation, all right, it leads to what we call hypersensitivity, all right? What is hypersensitivity? Hypersensitivity is the exaggerated response of the cardiac and the smooth muscle if autonomic nervous system are severed. Extremely important that you know this. Why? Because they test this a lot. For example, they ask, which of the following is true regarding the autonomic nervous system? Which one is true? They tell you it controls skeletal muscle contraction. No, it's not true. It has no ganglia along nerves. That's not true. It uses the neurotransmitter acetylcholine exclusively. No. It usually controls conscious actions. No. Unconscious actions. Then they say, is denervation would cause hypersensitivity? Yes. Or what if they ask you, which of the following is associated with flight or fight reaction? When they say flight or fight reaction, what are they talking about? They are talking about sympathetic. So in sympathetic happens. That's what the question is about. Okay, look at the options. Pupillary constriction. No. Okay, we will still get to it anyway. Glycogen synthesis. No. All those things synthesizes when you are resting. Increased gastric motility. GI. No. GIT is supposed to be reduced because this is sympathetic. Reduced heart rate. No. Your heart is supposed to be doing beep, 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 beep. Now they say you reduce urinary output. Yes, because when you are running, you don't feel like peeing. So it reduces urinary output and you don't feel like shitting. It reduces digestive activity. You should remember this. Wisdom. Now, something you must know, the autonomic nervous system. The autonomic nervous system in the components in both the central and the peripheral nervous system. You need to know those components, all right? One is the nuclei, the control nuclei, and that control nuclei is found in the hypothalamus and other brainstem regions, all right? Then the second one is the motor neurons. The motor neurons is in the spinal cord and also the peripheral ganglia. Then we have the nerve fibers that travel through the cranial and the spinal nerve. So if you understand that, you need to understand the contrast between the somatic pathway and the autonomic pathway, all right? The somatic pathway, motor neuron from brainstem or spinal cord issues a myelinated axon that reaches all the way to the skeletal muscle. So if you look at it very well, look at that diagram, you see, can you see the spinal cord, all right? You see the gray matter? You see how the motor neuron comes back, myelinated fiber, straight to where it's targeting, right? Releases acetylcholine and makes it happen. That's the somatic motor innervation. But when you're talking about the autonomic motor innervation, it's divided into two. As we mentioned initially, we have the sympathetic motor division and parasympathetic motor division. Both the sympathetic and parasympathetic motor division, they have something in common. And what is that? The preganglionic and the postganglionic. Very, very important. So the signal must travel across two neurons to get to the target organ. The first neuron is the presynaptic or the preganglionic. That synapse, you have presynaptic neuron. So the first neuron has a soma in the brainstem or the spinal cord. Then synapses with the postganglionic neuron whose axon extends to the rest of to the target cell. All right, very, very important that you understand this. So if you look at those two, you see both of them have the preganglionic and the postganglionic. The preganglionic and the postganglionic. You need to understand that. I will explain it more as we proceed. So now let's discuss the sympathetic division. This sympathetic division is that B as you are looking at it. You see that B? That's what I want to talk about. So if I go to this slide, you will understand it properly. These are the things you need to know. What's another name for the sympathetic division? They call it thoracolumbar division. Why? Because it's from the thoracic, the lumbar combined most times. So it originates from the thoracic and the lumbar regions, T1 to L2. Extremely important that you know this because it's always tested. Then they will ask you the fiber length and the ganglion location and also the distribution. These three things. So immediately you know the other name, which is thoracolumbar division, which is from T1 to T2 or L2. The fiber length, the ganglion location, you know the description, you are good to go. What is the fiber length? The preganglionic fibers are short. The postganglionic fibers are long. The ganglion location is where? In the paravertebral ganglia. We call it sympathetic chain. It's just adjacent to the vertebral column. You need to Google it and see the diagram properly. Then the distribution, it has 3 cervical, 11 thoracic, 4 lumbar, 4 sacral, ganglion. Extremely important that you know this. So they are actually distributed to every level of the body. Every level of the body. If you look at the diagram very well, you see the scheme. That's the schematic of the sympathetic nervous system. What do you see? You see the thick green, which is, and the red, which is the postganglion. If you look at it, take your time, pause this video and study this diagram. Extremely important. And when you study it very well, you understand. You see that vertebral ganglion is connected to a spinal nerve by 2 branches, all right? We call it the communicating rami. Now, it has the preganglionic fibers and it has the postganglionic fibers. The preganglionic fibers, you see these small myelinated fibers that travel from the spinal nerve ganglion. They travel from the spinal nerve itself to where? The ganglion. By way of the white communicating ramus. We call it myelinated communicating ramus. Those are the preganglionic. And remember, this preganglionic is short fiber for the sympathetic. All right? Now, look at the postganglionic for the sympathetic. So the postganglionic fibers, those ones that leave the ganglion to where? The target organ. You see how they target all the organ from the heart to the lungs to the esophagus, thoracic blood vessels, salivary, nasal, piloreceptor, what else? The dilator of the iris, the blood vessels. So they are distributed at all levels. So the neuronal divergence predominates. They will ask you this question. And what are we talking about? Each preganglionic cell branches and synapses on 10 to 20 postganglionic cells. That's what we call neuronal divergence. So meaning that one preganglionic neuron can excite multiple postganglionic fibers, leading to just one can affect the eyes, the heart, everything. So having a relatively widespread effect. That's what we call neuronal divergence. If you're asking an exam. So in conclusion, for the sympathetic pathways, we have the communicating rami, which involves the white ramus and the gray ramus. And the white ramus is myelinated preganglionic fibers from the spinal nerve to the the ganglion. That is what? The pre-ganglionic fiber. Now, the post-ganglionic fiber is the gray ramus. All right? It's unmyelinated. That's for sympathetic. Unmyelinated from the ganglion to the target organ. We already discussed the target organ. How about if they ask you a question such as, which of the following is not a feature of the sympathetic division of the autonomic nervous system? All right, meaning that you need to know all the features that we've already discussed. For example, it arises from the thoracolumbar region of the spinal cord, has long postganglionic axons, it's a ganglia, right? These ganglia are adjacent to the spinal cord. It has an extensive neural divergence and a relative widespread effect. All right, so you should, if you know all these things, then anyone that it's not familiar to you, you throw it away. You know that it is not a feature of the sympathetic division. All right. Now they may ask you this question: which of the following structures releases neurotransmitter molecules in a paravertebral ganglion? Which one? If you look at the diagram there, you will see the ganglion in the middle. For the sympathetic, you will see the ganglion. All right. So, and that it is the one that is pouring that neurotransmitter is what? Is the sympathetic pre-ganglionic axon. So that's what you should be looking for in the option. So if you look at it very well, if they ask you this kind of question, which structure releases your neurotransmitter? It is the pre-ganglionic of the sympathetic axon. Do you understand the point? And also they may be asking you about the synapses, all right? Like most pre-ganglionic axons in the sympathetic nervous system, synapses with how many? How many can the pre-ganglionic axon synapse with? How many post-ganglionic? That's what they're asking you. So you are telling them that it's between 10 to 20 post-ganglionic neurons. You need to remember this. Now let's talk about the adrenal glands, because the adrenal gland has a sympathetic role. All right, extremely important that you know this. First of all, you need to know that the adrenal gland, they are paired adrenal, right? They are suprarenal glands located at the superior poles of the kidney, just above the kidney. All right, located on and above the kidney, superiorly. So there is, if you bring an adrenal gland, you can divide it into two equal parts. Like if you open it, divide it, you will see the cortex outside and you see the medulla inside. The cortex is outside and the medulla is what? Inside. We are more concerned with the medulla because the medulla is what? The has the sympathetic function that we want. All right. Now, but I will tell you a little about the cortex. The cortex is divided into three regions: GFR, glomerulosa, fasciculata, and reticularis. That's GFR. The glomerulosa secretes what? Minerals like aldosterone. While the fasciculata, is in charge with what? Glucocorticoids, like what? Cortisol. All right? Cortisol and other steroids. You understand? Then the reticularis, GFR, the reticularis is the last part of the adrenal cortex. All right? It also secretes other steroids and androgens. So you need to understand this part very well. But what we are interested in is not the steroid hormones. What we are interested in is the middle, which is what? The medulla. Now, this medulla, it secretes what? Specifically catecholamines. 85% of the catecholamines it secretes is what? Epinephrine, which is adrenaline, and 50% is not epinephrine. You need to understand this. But the most important thing about it is that it's essentially a sympathetic ganglion. All right? Sympathetic ganglion. What does it contain? It consists of what? Modified postganglionic neurons that does not have fibers. So, meaning that it is stimulated by what? Pre-ganglionic or sympathetic neuron. That's why we call it what? Sympathoadrenal system. Does it make sense to you? So, adrenal gland, adrenal medulla is what? Post-ganglionic what? Neuron. Simple. It's modified post-ganglionic neuron. And any post-ganglionic neuron is being what? Is being activated by what? The pre-ganglionic sympathetic neuron. So, if you know that, you are good to go. Now let's talk about the parasympathetic division. All right, we already discussed the sympathetic division. That's the fight-flight. All right, the parasympathetic division is known as what? Craniosacral division. Why the sympathetic is what? Thoracolumbar. So the craniosacral means it arises from the brain and also from the spinal cord. All right, the sacral region of the spinal cord. Which part of the brain? Midbrain, pons, medulla, MPM. Now, from the sacral region, right, it comes from the S to what? S4. These are the information you need to know. That's why they are highlighted for you here. All right. The beautiful thing about it is that it has a very long preganglionic neuron. Very long preganglionic. Unlike sympathetic that has short preganglionic, long postganglionic. This one has long preganglionic, short what? Postganglionic fiber. And another thing with less neural divergence. Unlike the sympathetic that has a wide range of effects, a wide range of neural divergence. This one has what? Less neural divergence. And because it has less neural divergence, it's very specific. Now, let's look at specific to what? Specific to what? Narrowing of the pupil and focusing of the length using the oculomotor nerve, all right? That's spheres, nasal, salivary, cranial nerve 7, facial nerve, salivary gland, cranial nerve 9, that's glossopharyngeal nerve, and also vagus nerve, cranial nerve 10, which helps in cardiac, pulmonary, esophageal plexus that give off what? Anterior and posterior vagal trunk. So these are how the specific areas that works with parasympathetic division. Unlike the sympathetic that works everywhere, touches every part of your body. Generalized divergence. But this one is very much specific. Little neural divergence. You need to know these four things I just mentioned: the oculomotor, the facial nerve, the glossopharyngeal, and the vagus. And you need to know the parasympathetic division. If it's activated, what does it do exactly? You get the point? That's what they will ask you. I'll give you some questions. You understand what I'm talking about? So if you look at this picture, you will notice the divergence. Let me make it big. Okay, good. You see, it has less neural divergence. Where is it affecting? The eye, all right, the heart, the tear gland, the parotid, and other places like the pulmonary, the esophageal. So you need to know where it affects and what it does there exactly, all right? And which nerve exactly does it move with? Which particular nerve specifically? You need to know that. Now let's talk about neurotransmitters of the autonomic nervous system, all right? How do autonomic nervous neurons have contrasting effects on organs? That's the question, all right? Why? And the reason is because they have different receptors and also different neurotransmitters. Funny enough. And funny enough, you can actually have one neurotransmitter. It will act here differently from how it's acting here. You understand? The same Nchebe. I meet this person, I act differently. I meet this person, I act differently. See? So there are two fundamental things, right? Sympathetic and parasympathetic fibers, they secrete different neurotransmitters like norepinephrine and acetylcholine. Now, the receptors target different cells, all right? Also very, very important. Now, what are the two major, we are talking about the neurotransmitters now. The two major neurotransmitters is norepinephrine, all right, and acetylcholine. That's what they usually use. Now, let's talk about acetylcholine, first of all. Acetylcholine, what do you need to know? You need to know that acetylcholine is secreted by all preganglionic neurons in both sympathetic and the parasympathetic. As far as it's preganglionic, they must secrete what? Acetylcholine. Check it out. Also, you should know that acetylcholine is secreted by postganglionic parasympathetic neurons. But mind you, if we go to postganglionic, it has to be what? Parasympathetic. That means postganglionic sympathetic, you understand, does not use acetylcholine. Instead, what do they use? Norepinephrine. Norepinephrine. Sweat gland. Extremely important that you know this. So all preganglionic acetylcholine, parasympathetic postganglionic acetylcholine, sympathetic postganglionic norepinephrine, and you are good to go. Your hands off. You get it? Now, the acetylcholine, the receptors, we call them what? Cholinergic fibers, and the norepinephrine, we call them what? Adrenergic fibers. We are going to discuss them. We're going to discuss the cholinergic, and we're going to discuss what? The adrenergic, because this thing comes out in your exam. And I will show you questions. Now, when you're talking about the cholinergic receptors, all right, that's the one that uses ACH, acetylcholine. They are divided into muscarinic, rather. What am I saying? Muscarinic receptors and also what? Nicotinic receptors. When you're talking about muscarinic receptors, you're talking about the ones that goes to the cardiac, smooth, and the gland. They are called what? Visceral effectors. Visceral effectors. Visceral what? Effectors. The cardiac, the muscle, the smooth muscle, and also what? The glands. They can be either excitatory or inhibitory. But when you're talking about nicotinic, the ones that are nicotinic, usually on all ANS postganglionic what? Neurons. Talk about what? Adrenal medulla and also the neuromuscular what? Junctions of the skeletal muscle. That's the somatic effectors. All right? They can only, acetylcholine there only causes what? Excitation. Can only be what? Excitatory. What are we saying? We are saying that when acetylcholine, you understand, happens in the heart, when it happens in the glands, and also in the smooth muscle, it can be what? Excitatory or what? Inhibitory. But when you think of acetylcholine in the skeletal, it must be what? Excitatory. Chicken. Okay. Now let's talk about adrenergic receptors, all right? Norepinephrine, remember I talked about norepinephrine, which is secreted by nearly all sympathetic what? Postganglionic. All right, we call them our adrenergic fibers. Now, what you need to know is the neurotransmitters are first messengers. You should always remember they are what? First messenger. They lap on the receptors, which is the bouncer on the door, to activate the second messenger inside to cause their what? Effect. All right. So Now, which is the first messenger, it activates eastbound on the dog, which is what adrenergic receptor. Do you understand? Then the adrenergic receptor will now act with its what? Second messenger. Now, this time around, the adrenergic receptors can be alpha and can be beta. Alpha, always excitatory. Why the beta always what? Inhibitory. So if you hear that something lapse on the beta, it leads to what? Inhibition. So the sympathetic nervous system inhibition. Does it make sense? You understand? Because this is the postganglionic what? Sympathetic. All right? So you need to know that the alpha can be divided into alpha 1 and alpha 2, and each of them has what the different what second messenger. But for the beta, they have the same second messenger, which was CAMP. Extremely important that you know this. Most organs have dual innervation, all right? So, you know, it can be getting from the sympathetic and from the parasympathetic. That's what we call dual innervation. Now, those dual innervation can be antagonistic or it can be cooperative. All right. When it's antagonistic, they oppose each other. When it's cooperative, they join together to to increase their overall effect. All right. Very, very important you know this. But what you must know is that their influence is never the same. For example, parasympathetic nervous system exerts more influence on digestive organ more than sympathetic. But sympathetic has more effect on the heart more than the parasympathetic. Does it make sense? Yeah. So examples of antagonistic, you should know that, like, for example, the parasympathetic increases the heart rate, the sympathetic decreases it. You know that, right? Aha. Also, think about the dilation of the pupil. All right, the sympathetic does what? What does the sympathetic do? It dilates the pupil. We call it a pupillary or dilator. Sympathetic dilates the pupil. So when you are running, for example, when you are in sympathetic action, right, your pupil what? Dilate. But in parasympathetic, your pupil what? Constrict. Those are antagonistic what? Effect. They are opposing each other. All right. And when we are talking about cooperative effect, talk about salivation. Parasympathetic we cause salivation. Sympathetic will still cause what? Salivation. You understand? Leading you to salivate more. So you salivate when you are resting or when you are in action. This is what I'm talking about in terms of what? Dilation. All right? Sympathetic dilates, parasympathetic constricts. Extremely important that you know this, which is the same thing as this as well. All right? I'm just trying to show you a lot of pictures so that you'll be able to remember the dual innervation, because they ask a lot of questions from it, which I'm going to show you in a minute. Some effectors, they have only one innervation. They don't have dual innervation, like some sympathetic fibers, all right? Like sympathetic fibers in the adrenal medulla, the erectopili muscles, the sweat glands, and many other blood vessels. All these things have only one sympathetic fiber. You need to know these examples because they will ask you, which of the following has, dual innervation? And they give you all this and give you one that doesn't. So how does this control work? You understand? How do they now control? What you need to know is that when they increase their firing, it leads to one action. When they reduce the firing, it leads to another action. All right? For example, the sympathetic vasomotor tone usually keeps the blood, you understand, in a partial constriction. So the blood can be moving. You understand? So the baseline sympathetic firing keeps blood, vessels in a partial constriction. You know what I call tone? I usually refer it to as maybe when you start your car to heat up. That is tone. That's what I refer to as tone. So it keeps it in partial constriction so that it can make the blood move without you even knowing it. Now, what of when it causes vasoconstriction and vasodilation? How does it do it? Since it has one innervation. You understand? So how does it do vasoconstriction and vasodilation? Simple. For vasoconstriction, it will increase firing. Once it increases firing, squeeze. Squeeze. At that moment, the smooth muscle contracts. You understand? The vessel diameter decreases. The blood flow decreases. All right? Now, vasodilation. What happens? Vasodilation, it just decreases its firing. It may decrease its firing, the smooth muscle relax, the vessel diameter increases, the blood can flow properly, increasing blood flow. So that is how vasoconstriction and vasodilation works. You understand? So it alternates. Where does it shift blood to? When there is crisis. All right? When you are running, where does it shift blood? When you are relaxed, where does it shift blood to? That's exactly what this sympathetic vasomotor tone is all about. So if you don't understand it properly, please, I want you to pause the video or go back and listen again to what I'm saying. When I give you more questions, you will understand. They may ask you a question. Let me recap, all right, with questions. They may ask you a question. White rami carry dash neurons. Why gray rami carry which neuron? Can you remember? Can you remember? Let me go back so that you look at what we discussed. Do you still remember what I told you here? White rami carry what? Myelinated preganglionic. Why gray rami carry what? Unmyelinated postganglionic. They will give it to you. I have to remember it. All right. Now they may ask you, adrenal medulla secretes mostly dash. What does it secrete? The medulla. What does it secrete? Catecholamine. Now it secretes catecholamines, but mostly what? Which particular catecholamine does it secrete most? Epinephrine. That is what adrenaline. I mentioned it to you that it secretes about 85% adrenaline. Very, very important. How about if they ask you the neurotransmitters released by the preganglionic neuron is or dash? What is the answer? The one released by the preganglionic neuron. I'm looking at it right now. I want you to write it in the comment section below as a comment. All right? Write it down there and tell me the answer there. But please remember to write the question before you write the answer. They can also ask you a question. A neuron that synapses in the adrenal medulla is a dash neuron and releases the dash transmitter, neurotransmitter. Options: somatic, norepinephrine, no. Postganglionic acetylcholine, no. Preganglionic norepinephrine, no. Postganglionic norepinephrine, no. Preganglionic acetylcholine, yes. If a cell has alpha-1 adrenergic receptor, it is sensitive to dash. It is sensitive to acetylcholine, no. Sensitive to muscarine, no. Alpha adrenaline, what is that? Nicotine, no. Norepinephrine, yes. What about propranolol? Propranolol. Propranolol, they tell you is a beta blocker. It's typically used to do what? Decrease the heart rate. Do you understand? Typically used to do what? Decrease the heart rate. Extremely important that you know this. What if they ask you which of the following is more effective in producing bronchodilation? Is it acetylcholine? No. That one is activity, an increase in activity. Nicotine? No, it increases. Muscarine? No, it increases. Thyroxine? No, it increases. Norepinephrine? Yes. Why? Because it's inhibited. What about if they ask you about muscarinic receptors? What do they bind to? Epinephrine? No. Norepinephrine? No. That's monoamine oxidases or acetylcholinesterase? No. But acetylcholine. You need to know the difference between acetylcholine and acetylcholinesterase. Acetylcholinesterase are those enzymes that breaks down acetylcholine into choline and acetyl. All right? So that they will stop what? Contraction. So muscarinic receptors bind to what? Acetylcholine, not acetylcholinesterase. So it's under cholinergic what? Receptors. The binding of dash to a nicotinic receptor of a muscle fiber will dash it. What binds to nicotinic receptor? Acetylcholine. Check it out, and you are good to go. When acetylcholine binds to a muscle fiber, does it excite or inhibit? It excites. Chicken. So the binding of acetylcholine to a nicotinic receptor of a muscle fiber will what? Excite. Alpha 1, nicotine, alpha 2. Now, there's this question on atropine, which says atropine is sometimes used to dilate the pupil for an eye examination. Which receptor would atropine block? Think about it. Which receptor will it block? We have alpha-1 adrenergic receptor, we have nicotinic receptor, we have muscarinic receptor, we have alpha-2 adrenergic receptor, and we have what? Beta receptor. So I want to take time to explain this so that you'll be able to understand it. Atropine is a muscarinic acetylcholine receptor. The answer is actually muscarinic receptor. That's what it's going to block. All right. So it's a muscarinic acetylcholine receptor antagonist. So it's called what? Anticholinergic what? Medication. It's an anticholinergic medication. Remember, all these things, we use it for what? Pharmacology. That's why we are learning these things. So how does it cause pupillary dilatation? Or dilation, rather. Normal pupil constriction, right? The parasympathetic nervous system releases acetylcholine, which binds to muscarinic receptor on the sphincter pupillae muscle. Then pupil constricts. We call it what? Meiosis. That's a normal thing, all right? Parasympathetic nervous system releases acetylcholine. Acetylcholine, what? We do what? We now bind to muscarinic receptor on the sphincter pupillae and leading to pupil constriction. Now, what does atropine do? Atropine will come and block the muscarinic receptor. So if it blocks the muscarinic receptor, when the parasympathetic nervous system releases acetylcholine, it will not be able to bind on the muscarinic receptor. You see it? So it can't act. It can't cause pupil constriction. You understand? So immediately it removes the constricting tone. What happens? There will become an unopposed sympathetic activity through the alpha-1 adrenergic receptors. So that alpha-1 adrenergic receptor, which is sympathetic, will now cause what? Pupillary dilatation. That is what? Mydrias. So what does atropine block? Atropine blocks what? Muscarinic what? Receptors. And muscarinic receptors are for what? Pupillary constriction. So when it blocks the constrictor, it will automatically what? dilate. That's why they put it in your eyes, to dilate your pupil, so that they'll be able to what? See through it. All right. So the answer is muscarinic what? Receptor. So it's a muscarinic receptor and blocker. All right. Or acetylcholine receptor what? Antagonist. You need to understand this. And since we're already here, I mentioned to you that what breaks down acetylcholine is what? Acetylcholinesterase. What breaks down norepinephrine is known as what? Monoamine oxidase. Please put this in your head, because they ask you, like there's a question, they said the enzyme that breaks down norepinephrine is called what? Monoamine what? Oxidase. Monoamine what? Oxidase. Now, there are some drugs that they call monoamine oxidase inhibitors. If they ask you, what does monoamine oxidase inhibitor medications do? All right? They'll give you a lot of options, like activating parasympathetic division and allowing for normal digestive activity. Nah. Blocking acetylcholine receptors on skeletal muscle and causing flaccid paralysis. Error. Stimulates B2 receptors and cause an increase in heart rate and dilation of bronchis. No. Inhibits uptake of dopamine and cause depression. No. Instead, what MOA inhibitors does is that they decrease the amount of what? Norepinephrine destroyed. Simple. That's why we use them as antidepressants. Anti-what? Depressants. Remember, the epinephrine, adrenaline is action, right? Now, if somebody is depressed, that means the person needs what? Action. We give the person medication that will reduce the breakdown of those things that is supposed to make the person have action. Simple. That's the MOA. That's the sense behind it. So MOA inhibitors, normally we discuss that monoamine oxidases are what? Things that destroy what? Norepinephrine. They reduce norepinephrine. And norepinephrine is for action. Remember? So when we give you something that will inhibit monoamine oxidase, it will increase your action. So it decreases the breakdown of what? Norepinephrine, thereby increasing your action. That's why we use it as what? Antidepressant. If you don't understand me, if I'm too fast, please reduce the speed of the video or go back to watch it again. Control of the autonomic system. We have the cerebral control, all right? We've discussed all these receptors. Now let's talk about the cerebral control, because the ANS is regulated by multiple levels of CNS. You understand? Then we ask you where controls autonomic nervous system. We have the cerebral cortex, we have the brainstem, we have the hypothalamus, we have the spine. Simple. You understand? Because like when you are afraid, it triggers your autonomic nervous system. That's called the cerebral cortex. When they break your heart, you are angry. Your heart start moving. That is what? That is autonomic nervous system. All right? The brain, pons, medulla, cardiac center, all those things, salivation, swallowing, they control it. Bladder control. You understand? You think something. You understand? Maybe when you are afraid, you want to go wee. You understand? All those things are what? Are autonomic control. That's CNS level control. We talk about hypothalamus as well. When you are hungry, your stomach starts moving. That is what hypothalamus is in charge. What of spinal cord? All these things helps to control what? Autonomic nervous system. So you must remember them. Now, in terms of the medications, all right, you need to know about the sympathetic drugs and the parasympathetic drug. The one that increases the activity of the sympathetic is known as what? Sympathomimetics. All right? The enhanced activity of the sympathetics. The one that decreases the action or suppresses the activity of the sympathetics is known as what? As what? Sympatholytics. You need to know the examples. Like cold medication, they dilate airways and all those things. They are sympathomimetics. But all those medications like beta blockers, they decrease the activity. They suppress sympathetic activity. That's why we use them to reduce the blood pressure, the heart rate. All right? That's sympatholytics. You should know. Same thing goes with parasympathetics. The one that increases the activity of parasympathetic nervous system is known as what? It's known as what? Parasympathomimetics. Right? They increase the effect of ACH. But the one that suppresses the effect of ACH, we call them what? Parasympatholytics. They suppress the activity. You understand? Think about something like serotonin uptake, Prozac, or caffeine. Caffeine targets specifically what? Adenosine. They may ask you this question. I'm sure there is a question on that. Let me see if I can find it. Yes. Imagine this question that says, a possible explanation for the effect of caffeine is that it blocks the receptor for what? A neuromodulator in the brain called DASH, which inhibits ACH release by cholinergic neuron. What is that? Adenosine. Here they will tell you glycine, dopamine, serotonin, melatonin. All those things has nothing to do with caffeine. Caffeine works with what? Adenosine. Instead, it's a neuromodulator for what? Adenosine. That's how caffeine works. So when it modulates adenosine, it leads to what? Inhibition on ACH release by cholinergic what? Neurons. Extremely important that you know this. So as a little summary, All right, this is the sympathetic and this is the parasympathetic comparison. All right, the origin, the fiber length, the ganglion, the postganglionic neurons, the divergence, the general effects. I compared everything. So you need to pause the screen and look at it very well because you need this exactly to answer a whole lot of questions. There are a whole lot of clinical applications, like when you're talking about enteric nervous system, the one that happens in the stomach. When it's lacking, we call it what? Hirschsprung's disease. They may ask you this. Absence of enteric neurons causes what? Megacolon. That's Hirschsprung's disease. All right. Then we have autonomic dysreflexia. Right. This one is a life-threatening hypertension afterwards high spinal injury. It's known as autonomic what? Dysreflexia. Some people have spinal cord injury, and when you have spinal cord injury, there's loss of voluntary control over the bladder. All right. Bladder and bowel. We have orthostatic hypotension. Right. Which is when the sympathetic vasoconstriction is impaired when you stand up. You know, somebody stands up and the eyes start turning. That's orthostatic hypertension. There's a great change, you understand, of the blood pressure when you sit and when you stand. All right. And when the sympathetic vasoconstriction does not work well to equalize this change, it leads to what? Orthostatic hypotension. Then we have Horner syndrome, which is damage, you understand, to the sympathetic pathway. All right. Leading to what? Ptosis, meiosis, and hydrosis. Also, we have hypersensitivity, which I mentioned initially. We call it what? Denervation hypersensitivity. All right, that's exaggerated organ response if autonomic nerves are what? Severe. And that leads me to the summary of this discourse, part of the summary anyway. You understand? It's control, it's sympathetic activity, parasympathetic activity, enteric, right? Because they can function independently, dual innervation. You know, all these things are what we discussed. Central control from cortex, hypothalamus, brainstem, spinal cord, the drugs, right? Then this is the summary of the receptors, the neurotransmitters, the receptor type, the location, the effect. You need to pause this screen, use this particular page as your wallpaper. Acetylcholine, nicotinic, muscarinic, norepinephrine, alpha, beta, all right? Nicotinic, all ganglia, adrenal medulla, skeletal muscles is leads to excitatory. Anytime you hear nicotinic, it's excitatory. But when you hear muscarinic, it can be excitatory or what? Inhibitory, depending on where it is. It can be in the heart, smooth muscle, or the glands. When you talk about alpha, most sympathetic target organs, usually excitatory, beta, heart, lungs, blood vessels, usually what's inhibitory. You need to understand this. You need to know this because it comes out a lot in your board. It may not come out in your college exam so much, but it comes out a lot in your what? In your board. So these receptors, they determine the response, not just what? The neurotransmitter. So response is determined by the receptor and also what? The neurotransmitter. As a recap question, antagonistic effect of two divisions of the autonomic nervous system are exemplified in the control of what? Is it blood clotting? Sweating? High hair erection? No. GI motility? Yes. All right? GI motility? Yes. It has antagonistic effects. Sympathetic, we reduce the effect. That's why when you are running, you don't feel like shitting. But the parasympathetic, we what? Increase the effect. That's why when you are resting, you want to go to poo or go to toilet. All right. What if they say DASH is an example of cooperative effects between two autonomic nervous systems? Orgasm, bronchodilation, gastrointestinal secretion, heart rate, vasomotor tone, orgasm. Because if you listen to my video on reproduction, which I want you to go back now and listen to it. Go back and listen to it. You hear when we discuss sex properly. All right. Or also you go to my live where I discuss the reproduction. You hear where we're talking about sex. And during sex, right, we discuss the parasympathetic effect and what the sympathetic effect, how the two of them supports in erection, in ejaculation, in emission, and all those things during sex. So that phase of orgasm is dual. You understand? You need to put that in mind. The same thing with salivation. Same thing with what? Salivation. Dual. They are cooperative. All right. They may ask you which of the following contains primarily adrenergic fibers. All right. Is it the preganglionic neurons of the sympathetic division? Is it the postganglionic neurons of the parasympathetic division? Is it all motor fibers of the somatic motor system? Is it the preganglionic neurons of the parasympathetic division? No. It is what? The postganglionic neurons of the sympathetic division. That is what has primarily adrenergic what? Fibers. We discussed this. I hope you don't forget. Now, they may ask you which of the following is not under dual control of the ANS. And they're asking you which one has only what? One single control. You should know this. We discussed what it. We specifically mentioned that it is what? Adrenal medulla what? Activity. It is not the pupil. Pupil can dilate or constrict. Depends on if it's parasympathetic or sympathetic. So it's dual. Heart rate can go up or down, depending on if it's parasympathetic or sympathetic. So it's dual. All right. Salivary. Two of them can support salivary. You understand? Two of them join to have cooperative effect. GI the motility can be up if it is what? If it is parasympathetic, and it can be down if it was sympathetic. So it's dual. But which one is single? Adrenal medulla activity. You can't forget this. And when they're asking you the center for autonomic control, please remember it is hypothalamus. Sing it. Autonomic, hypothalamus, thalamus. Sing it. I play too much. And where does autonomic input functions receive their input from? They can receive their input from the cerebral cortex. I mentioned it. The neural cerebral cortex, hypothalamus, medulla, and also peripheral nervous. But do they receive from the spinal cord? No. They don't receive from the spinal cord. I mentioned this specifically. Now, they give you a question. Which of the following is not an example of how emotions influence the autonomic nervous system? Fear makes the heart race. Yes. So that is correct. Sexual thoughts increases genital blood flow. When you think evil, check blood flows inside. That is what? Correct. Anticipation of a meal makes the stomach rumble. When you perceive meal. Okay. That works. That's correct. Anger raises blood pressure. Yes, you see somebody that is angry, check the blood pressure. Pum, that's skyrocketed. That's why you should never be angry. That is correct. Anxiety increases sexual function. Anxiety. When you're anxious, do you perform better on bed? No. And that is the answer. So the question is, which of the following is not an example of how emotions influence what? ANS. Anxiety increases sexual function. It's not. So you should be thinking of the real things. All right. Now they're asking you which autonomic reflex is not controlled by the spinal cord. Spinal cord can control a lot of things like urination, defecation, erection, ejaculation, shun. But vasoconstriction, no. Spinal cord does not control how your blood moves. That's why even if somebody has a problem, accident, spinal cord injury, it doesn't affect the person's blood flow, vasoconstriction. No. It can affect urination, defecation, erection, ejaculation. Okay, depending on the point on the spinal cord. But vasoconstriction, no. Finally, this question, which of the following is more effective in producing bronchodilation? Dilation, relaxation, right? Shun. Acetylcholine, no. Nicotine, no. Muscarinic, no. Thyroxine, no. Have I mentioned this question before? I think so. The answer is what? Norepinephrine. That is what produces what? Bronchodilation. This is how we come to the end of our discourse today. I hope you enjoyed it. Please try to subscribe, try to comment, try to like, and try to on your notification bell. These 4 things, if you can do them for me, I will appreciate. All right. I hope you've understood autonomic nervous system. I will encourage you. Use your AI. You understand? Generate a lot of questions on autonomic nervous system. Generate a whole lot of them. The ones I've discussed, write them out. Use it as a prototype. Go back to it. Think of what I explained are the answers or why they are the answers. All right. Look at the slides I just posted. Look at the slides very, very well. If you need this slide, I want you to make a comment. I need this slide. All right. And you can drop me your email. All right. I will appreciate it. Or better still, if you need this slide, you can send me a message on Instagram. You see my Instagram handle at official Dr. Ray, Dr. R-A-Y. All right. Send me a message on my Instagram that you need this slide. All right. Then I will ask you for your email address and I will send it to you. So you don't need to put your email in the comment section. But before you do that, I have to check if you have already made a comment in the comment section. So make a comment in the comment section, then send me a message on my Instagram and I will send you the slide. All right. Thank you so much and have a nice day. Bye.